So you've called us up, you fixed an appointment with me. You're coming in for a consult for a breast augmentation. To know what will happen during the consult, check out this video. Hi, I'm Dr. Saumil Shah. I'm a plastic surgeon and director of plastic surgery at Skin Zone Aesthetics in Borivali, West Mumbai. So when you come in, you'll be greeted by a front desk. They will take down a few details and then you walk into my cabin. Once you come in, we'll sort of first discuss as to what you actually want. Many times, a lot of women are confused whether they just want an augmentation, which is increasing the volume, or they want a lift or a combination of the two. So for that, we'll first examine you. Once the examination is done, we'll say come to a conclusion, and we come to a conclusion that you only need an augmentation. Then comes the second step of understanding how the augmentation is done. There are two ways how we can do augmentation. One is through an implant and second is through fat. Now depending on the pros and cons, we'll sort of come to a conclusion as to what you want to do, taking your input into consideration. Now we've decided that we are going to get a breast implant. First thing that we'll do is show you what an implant feels like and looks like. You can touch it, you can feel it, you can feel how natural it feels and what the feel is similar to a breast. We put very similar types of implants. The implants are of different companies, but they almost feel very similar. The next step we go to is through line diagrams. We'll show you where the implant will be put, the relevant anatomy of it, because we usually do what is called either a dual plane or subglandular, and then why we do which one. So all of that will be explained to you. We'll explain you where the cuts will be, how big the cuts will be to put the implants in. We also discuss about the side effects of your surgery, the side effects of implants, the relevance of choosing bigger and smaller implants, and why we do perfect measurements along with a 3D reconstruction on a software called as Chrysalix to show you which size implants will be the best for you. I don't like putting oversized implants, and we also go through the entire process. So it's usually not a single size fits all. We'll show you relevant charts and the diagrams as to why we choose different sized implants, and we use implants from companies that are internationally recognized. We don't use the low quality implants at all, and we'll also go through the entire process of why all of this is done. Once the consultation is over, the first consultation is over, when you go home, we'll give you patient information booklets and also implant information booklets where you can go through all of them. We'll also provide you with PDFs and a small video as to what is relevant regarding breast augmentation. Once you go through all of them, I would want you to come back, or we can speak on the phone, and you can sort of then decide whether you want to get the surgery done or you want to defer it. All of this is still in your hands, and we like to give all of the information to you and then let you decide whether you want the surgery done or not. So this is how a typical consultation for breast augmentation or a breast implant goes like. If you have any other questions, you also get my personal WhatsApp and our office WhatsApp. If you can't get in touch with me, I'll always be available and be getting back to you. If there are any other relevant information that you need from me, you will get them as well. Or if you want to discuss something where you've read something that's different from what we have told you, you can get back to us on that as well. We are also available to answer questions for patients who've still not had consultations with us or have had consultations with other doctors and need some more information. So do get in touch with us on our phone, or you can just drop in.